I'm happy to discuss a recent publication by Anna Thomas and colleagues on outcomes of a first-line therapy after CD19 CAR-T treatment failure in large B-cell lymphoma. The rationale for this study was the relatively high rates of relapse and progression after a CD19-directed CAR-T cells in large B-cell lymphoma. We know that approximately 60% of patients ultimately progress or relapse after CAR-T cells. Although these are still better outcomes compared to the earlier results in patients, with relapse refractory large B-cell lymphoma. There is still a lot of room to improvement. And at the time that we performed the study, not a lot was known about what actually happens to patients after CAR-T treatment failure. So to study that, we developed or combined a retrospective cohort from Memorial Sloan Kettering in New York and Sheba Medical Center in Ramat Gan, Israel. We had approximately 300 patients treated with CD19-directed CAR-T cells. The majority, all of them autologous CAR-T cells, the majority of them were commercial CAR-T cells. And what we observed is that, relapse and progression was indeed quite common for about 60% of these large B-cell lymphoma patients. But more importantly, patients that failed or failed by the treatment of CAR-T had relatively short progression-free survival and event-free survival. In the median event-free survival was just a few months, and the event was defined as relapse, progression, death, or next-line anti-cancer treatment after CAR-T cells. Then what we did is ask ourselves, can we identify any predictors of patients that would actually do better after CAR-T treatment failure, and developed a sort of a semi-score, a small score based on 4 risk factors. It was a bulky disease at time of apheresis, lack of response to CAR-T, older age, and elevated LDH at time of next-line treatment after CAR. And patients that had 2 or more of these factors had a very, very short overall survival compared to patients having only 0 or 1 of these factors. We also asked, what are the outcomes with different treatments after CAR-T cell therapy? The sample size did not allow us to investigate, the actual, or compare, I would say, the actual impact or benefit of specific type of regimens or treatments after CAR-T. But I think that one theme that was predominant there is that patients receiving chemo-based salvage regimen after CAR-T cell therapy did considerably worse than patients receiving more novel agents like lenalidomide-based regimens or pola-based regimens. However, obviously there were a lot of biases here, and we were not powered to compare it. I think overall, this study was among the first to actually represent or show the dismal outcomes after CAR-T cell failure and the need for better treatments and protocols to salvage these patients and potentially bring them to cure.